Hey, good morning. It's Dr. Steve here. Some of you may know that I just had hernia surgery. This is day 5, and it's very painful. And a very wise friend of mine suggested that I do a guided meditation for managing pain. So that's what we're going to do. So here I am in my pain cave. I'm sitting, been living on the couch for 3 days. Got a fire going. I've got my music, got my guitar, got my harmonicas, pain meds, coffee, glasses, everything a painful patient could ever require. Okay, so now we'll get started. I'm going to remind you again, I'm going to review for you, what is mindfulness? Mindfulness means to be in the present moment, by choice, without judgment. It really comes into effect when we're talking about managing pain, because you're certainly in the present moment. You may not be by choice, and it's really easy to judge, like having thoughts like, this sucks. Ow. Youch. Life is so unfair. Why me? Woe is me. And so on and so forth. So the present moment, what is that? That means that you're right here, right now. And we know that we can connect with the present moment by our breath. So when we feel our breath, we're feeling it right here in our somatosensory cortex. That's in our left frontal cortex and parietal cortex. It's a completely different place from here, the middle of our frontal cortex, where we have cognition. That's where we worry and so on. And research has shown that when we focus on our breath and when we activate our somatosensory cortex, it's good for us. There's all kinds of research. You can improve your memory. You can reduce anxiety. You can improve your peripheral vision. You can improve your blood pressure. So let's focus on the breath for the next few minutes while we talk about managing pain sensations. So when you're ready, close your eyes. A few deep breaths. And for me, I'm focusing on the pain of my incision. I have about an 8-inch incision. This is day 5 in my groin, from my hip to my crotch. I thought about giving you a picture, but that just would have been cruel. In the pain, there's different sensations. Sometimes it burns. Sometimes it feels like a cut, like a knife. Sometimes it feels like an electrical shock. And I've experienced this before. I had some back issues previously. And you think about the type of pain, and it can be a combination of burning and throbbing and cutting. But if you somaticize that pain and think about the quality of it, of its character, while you're doing that, it doesn't hurt as much. I heard an old monk talking about meditating on pain and welcoming the pain like it was your friend. Hello, old friend. Hello, Mr. Pain. Because when you feel that pain, you know that you're alive. And it's understood that as you sort of intellectualize this pain and think about it, it just hurts less. You start going, oh, yeah, there's a burning sensation there, but oh, now it's not burning quite as much. Now it just more feels like a stretch or a pull. And for me, as I go through that process, I'm using my somatosensory cortex, my left side of my brain, and I'm not thinking about how horrible this breath is and how cruel life is to poor little Dr. Steve. And the fact is, lo and behold, it hurts less. I also think that maybe as you breathe, I like to imagine that I'm oxygenating my tissues. And I'm sending healing oxygen to my wound. Whether I am or I'm not, as far as I'm concerned, I am. And so it is. So as we come to a conclusion here, nice deep breaths, feel every breath. Feel it in your tummy. Feel it in your nostrils. Feel it. Because as you feel your breath, you can't feel your pain at the same time. You can rapidly switch back and forth between them, but it's truly one or the other. So guys, as we wind down here, those are my little reflections on managing pain through meditation. Hope you have a great day.